number of people in a hospital room really affect the safety of those patients? According to recent Canadian research, the more patients that are sharing a room in the hospital, the greater the risk becomes of acquiring an infectious disease. Each year in Canada, about 225,000 patients suffer from infections acquired during their hospital stay. These infections include C. difficile, MRSA, and vancomycin-resistant enterococcus. Between 8,000 and 12,000 patients die annually as a result of these infections. Hospital-acquired infections are the fourth leading cause of death in Canada, after cancer, heart disease, and stroke. Hospital-acquired infections have a high cost for the healthcare system. According to a survey of Canadian hospitals done in 2000, the direct cost of hospital-acquired infections in Canada is estimated to annually reach $1 billion. In the UK, research found that patients who have acquired infections in the hospital, compared with those who are uninfected, on average stay in the hospital 11 days longer, have 3 times greater hospital costs, and have more than 3 times greater post-discharge costs. This raises hospital costs by about $6,000 per patient. Much of the hospital-acquired infection is due to overcrowding of hospitals and patients sharing rooms. A study conducted at Kingston General Hospital in Ontario and published in the American Journal of Infection Control showed that each roommate a patient is exposed to increases the risk of infection by 10 to 15%. The Kingston General Hospital study also showed that the average number of roommates was just over 2, but due to lengthy stays and heavy rotation of roommates, the number could go as high as 46.
Increased occupancy rates leads to an increased incidence of infection.
These data collected by Graham Gidney on hospital building design and how it contributes to hospital-acquired infection shows that a higher bed occupancy rate leads to increased incidence of infection for C. difficile and MRSA.
Single patient rooms are one way of actually allowing greater occupancy in hospitals, but without the risk of infection outbreak.
Research papers have found that single inpatient rooms have resulted in a staggering 45% reduction in the spread of infections when rooms are converted to singles.
Clearly, one of the best ways to cut hospital-acquired infections is with more single-patient rooms. While the upfront cost of converting hospitals to all or mostly single-patient rooms is high, the impact on reducing hospital-acquired infections would lead to long-term savings to the healthcare system. At Calgary's Foothills Medical Centre, a new acute care ward was built in 2004 with 80% single-patient rooms and no shared toilets. Now, hospital-acquired infections are 70% lower than they were in the older ward. While awaiting the reconfiguration of hospitals to more single-patient rooms, an interim step would be to increase the frequency of hand washing. Increased hand washing by health staff is a simple way to reduce the spread of infections. The addition of more sinks, especially making those sinks close to the patient room's door and more accessible and visible, would increase the frequency with which those sinks are used. In conclusion, one of the best ways to reduce hospital-acquired infections is by reducing the number of patients per room. But while we await the reconfiguration of hospitals to more single-patient rooms, it's important that healthcare workers realize the necessity for frequent hand washing and to prevent the spread of infections between patients. Here are a couple of questions to test your knowledge of this presentation.